Did you know that your body might be sending you urgent warning signals right now? Signals that most doctors overlook during routine checkups? If you're over 60, especially over 70, you could be experiencing subtle changes that indicate accelerated aging. Yet these symptoms often go unnoticed until they become serious problems. Today, we're diving deep into 7 silent signals that your body is aging faster than you think. These aren't the obvious signs everyone talks about. These are the whispers your body makes before it starts shouting. About 20% of people over 50 face age-based discrimination in healthcare, where treatable concerns get dismissed as just getting older. But here's the truth. Just because something is common with aging doesn't mean it's normal or untreatable. By the end of this video, you'll understand exactly what to watch for, why these symptoms matter, and most importantly, what you can do about them. Let's uncover the silent signals your body has been trying to tell you. Signal number 1. Your balance isn't what it used to be. Have you noticed yourself reaching for walls more often, or feeling unsteady when you stand up? Balance issues affect approximately 25% of adults aged 65 and older, making it a primary reason for medical attention. For those 75 and older, this risk increases dramatically and strongly correlates with falls. Here's what's happening. Most balance problems stem from changes in your inner ear, which controls your equilibrium. You might experience a spinning sensation, even when sitting down, feel dizzy without explanation, or sense that you're floating when you're standing still. These sensations can last anywhere from a few minutes to several days. The danger isn't just the discomfort, it's what comes next. Balance issues are the leading predictor of falls in elderly populations, and falls can trigger a cascade of health complications. When blood circulation slows down with age, oxygen doesn't travel as quickly to your brain, muscles, and organs, creating those unsettling moments of imbalance. Signal number 2. You're losing your sense of smell. This one surprises most people. When was the last time you truly enjoyed the aroma of your morning coffee or noticed the scent of flowers? A person's sense of smell declines gradually over time, especially after age 70, a phenomenon called presbyosmia. This happens due to a loss of nerve endings and reduced mucus production in the nose, which helps odors stay long enough to be detected. But here's the critical part. Loss of smell isn't just about missing pleasant aromas. Research shows that olfactory dysfunction can be an early warning sign of Parkinson's disease and Alzheimer's disease. The neurodegenerative processes involved in these conditions damage the nerves responsible for smell. Studies have demonstrated that olfaction worsens as patients progress from mild cognitive impairment to Alzheimer's, making smell loss a potential early diagnostic tool. Beyond neurological concerns, diminished smell affects nutrition and quality of life. Many seniors unconsciously compensate by eating more sugary or salty foods because these flavors remain pronounced, potentially leading to weight gain or poor dietary choices for those with diabetes or heart disease. Signal number 3. Your hands and feet are always cold. Do you find yourself wearing extra socks, even in mild weather? Are your hands constantly chilly, no matter how many layers you add? Cold sensitivity is common among the elderly due to physiological changes, including reduced muscle mass, slower metabolism, and diminished circulation. Pay attention to these physical symptoms. Pale or bluish skin, cold extremities, persistent shivering, chattering teeth, slow heart rate, fatigue, and numbness in fingers and toes. While cold hands might seem like a minor inconvenience, they signal that your body's circulation system isn't functioning optimally. What makes this particularly concerning is the progression risk. Cold sensitivity can advance to hypothermia, especially in elderly individuals. The symptoms can be subtle and easily mistaken for other conditions. Shivering, pale or bluish skin, slow pulse, and cold hands are physical signs, while confusion, memory loss, slurred speech, and drowsiness indicate behavioral and cognitive changes. Here's the dangerous part. As hypothermia progresses, shivering may actually stop, a critical indicator that the body is losing its ability to generate heat. Many older adults don't recognize or can't communicate these symptoms, making caregiver awareness essential. Signal number 4. You wake up tired despite sleeping. You spend 8 hours in bed, but you wake up feeling like you haven't slept at all. This isn't normal aging. It's a warning signal. Many seniors experience disrupted sleep patterns due to conditions like sleep apnea, restless leg syndrome, frequent nighttime urination, or chronic pain. Sleep apnea deserves special attention. This condition causes breathing to repeatedly stop and start during sleep, preventing restorative deep sleep and straining your cardiovascular system. Watch for these warning signs: loud snoring followed by silent pauses, gasping or choking sounds during sleep, excessive daytime sleepiness or morning headaches. Poor sleep quality, even when spending adequate hours in bed, leads to daytime exhaustion and affects every aspect of your health. The problem compounds when pain disrupts sleep patterns. Older adults have a diminished sense of thirst and may become dehydrated, which reduces blood volume and forces the heart to work harder, manifesting as persistent fatigue. Signal number 5. Food doesn't taste like it used to. Have you noticed that your favorite meals seem bland? That your taste preferences have changed dramatically? The number of taste buds decreases as you age, and each remaining taste bud begins to shrink. Sensitivity to the 5 basic tastes often declines after age 60. There's another factor at play. Your mouth produces less saliva as you age, which can cause dry mouth and further affect your sense of taste. This isn't just about enjoying food less, it's about nutrition and health maintenance. When food loses its appeal, some seniors lose interest in meals, eat less, and consequently lose weight. Others unconsciously resort to eating more sugary or salty foods, because these flavors remain more pronounced despite limited ability to enjoy associated aromas. For elderly individuals with diabetes, heart disease, or other chronic conditions, these dietary changes can have serious health implications. The combination of diminished smell and taste creates a dangerous cycle. Food becomes less enjoyable, nutrition suffers, energy levels drop, and overall health declines. This can significantly affect quality of life, independence, and longevity. Signal number 6. You feel exhausted after minimal activity. You took a short walk to the mailbox, and now you need to rest for an hour. This level of fatigue isn't normal. It's a signal that something deeper is happening in your body. Sudden or persistent fatigue in the elderly can indicate several underlying issues that doctors need to evaluate. Anemia, particularly iron deficiency anemia, is a frequent cause of extreme tiredness in elderly patients. When your body lacks sufficient healthy red blood cells to carry adequate oxygen to tissues, fatigue naturally follows. Vitamin B12 deficiency, vitamin D deficiency, and inadequate protein intake also contribute to persistent exhaustion in older adults. Many medications commonly prescribed to seniors can cause fatigue as a side effect. If you're taking multiple medications, which most people over 70 are, the cumulative effect can be overwhelming. Additionally, electrolyte imbalances, particularly low sodium or potassium levels, disrupt normal cellular function and energy production. This persistent fatigue affects more than just your energy levels. It impacts your independence, your ability to maintain social connections, your mental health, and your overall quality of life. When simple tasks become exhausting, the temptation to become sedentary increases, which paradoxically worsens the problem. Signal number 7. You experience all of these together. Here's what most doctors won't tell you. Experiencing multiple subtle symptoms simultaneously is far more significant than any single symptom alone. When balance issues combine with loss of smell, cold extremities, unrefreshing sleep, taste changes, and persistent fatigue, your body is sending a coordinated message about accelerated aging. Aging biomarkers help establish biological age, which differs from chronological age. Your biological age reflects how your body is actually functioning, and it's the basis for in-depth aging assessment, early warning, and intervention for age-related diseases. Systematic research on aging biomarkers is crucial for promoting both basic and translational medicine for aging and enhancing the health of elderly populations. The silent signals we've discussed aren't isolated incidents. They're interconnected warning signs that your biological age may be advancing faster than your chronological age. This is particularly important because ageism in healthcare often leads to these symptoms being dismissed as inevitable parts of aging. About 20% of people over 50 face age-based discrimination in healthcare, where treatable concerns like falls, joint pain, hearing loss, or vision loss get ignored or dismissed. Medical professionals might check these symptoms immediately in younger patients, but overlook them in elderly patients, assuming they're just normal aging. Here's the empowering truth. Even though these challenges are common with aging, they're not necessarily a normal process of aging. Most of these symptoms are treatable, manageable, or can be significantly improved with proper intervention. The key is recognizing them early, taking them seriously, and advocating for yourself in medical settings. Ageism contributes to cognitive decline, more hospital stays, disability, worse health and quality of life, and depression. Over the long term, these attitudes actually shorten lives. That's why recognizing these silent signals and demanding appropriate medical attention isn't just about comfort. It's about longevity and quality of life. What you can do right now first, start documenting. Keep a detailed log of when you experience each of these symptoms, their severity, and any patterns you notice. This documentation becomes invaluable when discussing your concerns with healthcare providers. Second, schedule a comprehensive evaluation. Don't wait for your annual checkup. Request specific tests, balance assessment, olfactory function tests, circulation evaluation, sleep study if needed, comprehensive blood work, including vitamin levels and thyroid function, and medication review. Third, implement preventive measures immediately. For balance issues, start balance exercises and remove fall hazards from your home. For sleep problems, establish consistent sleep schedules and create optimal sleep environments. Address circulation by staying physically active and keeping your home adequately warm. Focus on nutrition by ensuring adequate hydration, eating nutrient-dense foods, and working with a dietitian if taste changes are affecting your eating habits. Fourth, advocate for yourself. If a doctor dismisses your concerns as just aging, seek a second opinion. Find healthcare providers who specialize in geriatric medicine and understand that these symptoms deserve investigation and treatment. Remember, these 7 silent signals aren't sentences, they're opportunities. Early recognition and intervention can dramatically improve your quality of life, maintain your independence, and potentially add healthy years to your life. Your body has been whispering these warnings for a reason. Now that you know what to listen for, you can take action before those whispers become shouts. Stay proactive about your health. Your future self will thank you for the attention you're paying to these silent signals today. If you found this information valuable, please share it with other seniors who need to hear this message. Subscribe to Healthy Aging Guide for more evidence-based content that empowers you to age well and live fully.